Congressman Bart Gordon of Tennessee. Congressman, undecided on the public option at $1,173,000 in donations from the health sector. I'm surprised. You should have already said no, and loudly. The only thing you should be undecided about is whether or not you're really a Democrat. So much for Congressman Gordon. Senator Max Baucus of Montana. Good evening, Senator. So you're supposed to be negotiating all this out with the Republicans and the hesitant Democrats to gain bipartisanship with a wholly owned subsidiary of the health sector. Bipartisanship that will get you what? A total of no votes? And your price has been, let's see, $414,000 in donations from the hospitals, $667,000 in donations from the insurance companies, just over $1 million from Big Pharma, $1,300,000 from other health professionals, and $237,000 from nursing homes. When you think of getting $237,000 in campaign contributions from nursing homes, Senator Baucus, do you ever think about whether they subtract that amount of money evenly from all the patients suffering and dying and the lousy ones, or just from a few of the lousy ones? So much for Senator Baucus. Sadly, this list could go on almost all night, too. I could ask Blue Dog Congressman Democrat John Tanner of Tennessee if, since he has gotten $215,000 from hospitals over the years, if I and the appropriate number of my friends were willing to make it $216,000, if we could buy his vote, or would there still have to be an auction? We could bring up Senator Hagan and Congressman Pomeroy, who at $628,000 appears to represent the insurance industry and not North Dakota. I could bring up Senator Carper and Senator Blanche Lincoln. And Senator Lincoln, by the way, considering how you're obstructing health care reform, how do you feel every time you actually see Senator Kennedy? We could bring up all the other Democrats doing their master's bidding in the House or the Senate, all the others who will get an extra 1,000 from somebody if they just postpone the vote another year, another month, another week. Because right now, without the competition of a government-funded insurance company, in 1 hour, the healthcare industries can make so much money that they would kill you for that extra hour of profit. I could call them all out by name, but I think you get the point. We do not need to call the Democrats holding this up blue dogs. That one word, dogs, is perfectly sufficient. But let me speak to them collectively anyway. I warn you all. You were not elected to create a Democratic majority. You were elected to restore this country. You were not elected to serve the corporations and the trusts who the government has enabled for these last 8 years. You were elected to serve the people. And if you fail to pass or support this legislation, the full wrath of the progressive and the moderate movements in this country will come down on your heads. Explain yourselves not to me, but to them. They elected you, and in the blink of an eye, they will replace you. If you will behave as if you are Republicans, as if you are the prostitutes of our system, you will be judged as such, and you will lose not merely our respect, you will lose your jobs. Every poll, every analysis, every vote, every region of this country supports health care reform and the essential great leveling agent of a government-funded alternative to the unchecked duopoly of profiteering private insurance corporations. Cross us all at your peril, because, Congressman Ross, you are not the representative from Blue Cross. And Mr. Baucus, you are not the senator from Sharing Plow Global Healthcare, even if they have already given you $76,000 towards your reelection. And Ms. Lincoln, you are not the senator from DeVita Dialysis. Because, ladies and gentlemen, President Lincoln did not promise that this nation shall have a new death of freedom and that government of the corporation, by the corporation, for the corporation, shall not perish from this earth. Good night and good luck.